I may have recommended a penile implant for you for a variety of reasons. For some men, it's that other treatment options either didn't work well or you just didn't like them. For a lot of men and couples, it's because you want to have spontaneous erections back in your life and really be in the driver's seat of when you can have sex and for how long. During penile implant surgery, the first step is prepping the patient. So that means shaving the genital area and using an antibiotic and antiseptic scrub to make sure that everything is sterile. The second part is using a small opening in either the top of the scrotum or right above the penis to access the penile tissue. I then take measurements from the inside of the penis. As I mentioned, part of your penis comes out of you and part of it goes down inside. So I measure specific to you and then decide which implant size is going to be best to give you the best amount of length and girth. I then insert the components of the device, that means the reservoir, the cylinders, and the pump into the scrotum, and then I close up. You wake up in recovery and are able to go home the same day. In most men, this is a same-day surgery. You go home the same day as the implant surgery itself. In a very small proportion of men, you may have to stay in the hospital for one night only. If you have any significant cardiac issues or neurological issues or any other health conditions that may be risky for you to have anesthesia, I'll ask you to undergo a medical clearance or a cardiology clearance. Because this is a same-day surgery, you will need a driver. Your driver should take you in the morning and then be available to pick you up and drive you home after surgery. For me, the instructions before surgery are very simple. I'll give you an antibiotic wash to use in the shower for the 2 days leading up to surgery. I'd like you to focus on cleaning the genital area, and please don't shave before surgery. I'll do that for you in the operating room. The nurses in my clinic will go over all of your medications on your medication list and tell you which ones to remain on and which ones to stop before surgery. If you're on any major blood thinners, I will ask that you stop those, but this is at the advice of your cardiologist or your primary care doctor. So we'll team up to understand which medications you'll need to stop and when. Before surgery, I ask that you avoid drinking and eating anything at all after midnight the night before surgery. That will prevent any delays or cancellations on your surgery day. I recommend that you wear comfortable, loose-fitting clothing on your surgery day. When you go home, you will have a catheter in your bladder, and so you will need to accommodate that through your pants. So wear something loose and very comfortable. I ask that you refrain from shaving, as I will do that for you in the operating room. Studies have shown that when we shave you ourselves, the infection risks actually goes down. So no need to shave prior to surgery. On your surgery day, you will come into our ambulatory surgery center where you will get checked in by the nursing staff, the anesthesia staff, and myself. When it's your time for surgery, we'll wheel you into the operating room and then you'll gently go to sleep. We'll do our work in the operating room and then wake you up, and the next thing you know, you'll be in recovery. You'll recover for typically about an hour to 2 hours to make sure that you're wide enough awake to walk out of there. You then go home and rest and recuperate at home. If you're feeling anxious about your procedure, that's entirely normal. It may help to review these videos or reach out to my office if you have any questions. That may calm your nerves a little bit. If you have questions leading up to your surgery, you can call my surgical scheduler or my nursing team. That goes for whether you're having surgery at the university or at the VA.